Our cornerstone levodopa therapy that's given orally is a miracle drug, but the irony is we deliver it through the GI tract, where esophageal and gastric dysmotility delays its delivery to the intestine, where it's absorbed through the large neutral amino acid transporter, and where protein can interfere with its absorption. And plasma levels of levodopa can be delayed, and this can lead to a delayed onset of benefit from oral doses of levodopa. So we've really looked for other ways of trying to treat this, and these on-demand treatments that can be used acutely to treat it off as needed by patients have been very helpful to patients. And we have inhaled levodopa and subcutaneous injection of apomorphine and a sublingual apomorphine film that's available. So we wanted to sort of understand how important would it be. So in one recent publication, we looked at time to on as being a major determinant of off time, as compared to the traditional view of end of dose wearing off, driving off time. And it's really important to focus not only in treating end of dose wearing off, but to ask our patients, does a dose of levodopa ever take longer than usual to work first thing in the morning, around mealtime, some other time, and to treat a time to onset of benefit, not just end of dose wearing off, and treating them both. I think we can do a better job in helping our patients. We've looked at this also in suggesting a paradigm shift of thinking about using on-demand therapies earlier, not keeping them as a late option. But whenever we think about treating patients to improve their off with an on extender or an adjunctive medicine, or increasing levodopa, or just in the timing of levodopa, we should also discuss with our patients on-demand therapy so they can be empowered when they're not in our clinics and they live in their daily lives, that if they experience an off episode, they know they have something, one of these on-demand therapies, to empower them and to be used to turn back on rapidly and reliably and robustly back to their full-on state. And we explored this further in a consensus meeting using a modified Delphi process globally with experts in Parkinson's disease, and found agreement that when off episodes affect daily activities, when they're severe, but also when they're frequent but maybe more mild or moderate, on-demand therapies are appropriate and should be considered earlier. So I think we're coming to a point where there's a real paradigm shift to think about on-demand therapies sooner, earlier, and to empower our patients to have control over their symptoms by using one of these therapies.